Hello and welcome to Wellness Wednesday. My name is Sally Duplantier. I am the founder of Zing and I am a gerontologist. And I have a mission to help older adults live their best life longer. Now, most of our Wellness Wednesday programs, which we've been running for 5 years, are focused on things like nutrition and movement and sleep and stress. But I think it's time to talk about something very important today, which is loss and grief. And I'm just delighted to welcome Dr. Mark Moore from Philadelphia. Hi, Dr. Moore.
Hi, thanks for having me.
Kind of an analogy about today's program is that we talk a lot about joy and resilience and happiness and purpose. And I think those are all very, very important. But loss and grief are a little bit like the elephant in the room. And it occurred to me in talking to many of you in the community that I serve that we should be talking about loss and grief. So I'm just delighted to welcome Dr. Moore. He is a clinical psychologist and psychoanalyst. He is with the Psychoanalytic Center of Philadelphia. There he serves as curriculum chair and education division director. He is an award recipient of the Edith Sobchen Teaching Award from the American Psychoanalytic Association in 2020. And his clinical work focuses on things like self-understanding, the creation of meaning, and the role of play in emotional well-being. His long-standing interest and research focuses on chronic illness, losses, and life transitions that are associated with cancer and fear of dying. And I'm just so delighted that he is joining us today. Before we dive into today's topic, I do have a few thank yous. Look at all the different organizations that are promoting Wellness Wednesdays. And I want to make a special welcome to Hearts and Minds Activities Center in San Jose, our newest partner. And I also want to thank all of you, our community supporters, who provide funding to help make these programs available to everyone and at no cost. So as we go, Dr. Moore and I are going to be having a conversation. From time to time, I'll be asking you to type things into the chat. But if you have questions for Dr. Moore at the end of the session, we'll save about 10 minutes and you can type those into the Q&A as we go. All right, so let's get started. And Dr. Moore, I'm going to begin with a question about definitions. We talk a lot about grief and loss, and I know those are complex terms, but maybe you can give us kind of a working definition and then tell us how they're related.
Sure. I think the easiest way is to draw the relationship between the two and to start with grief, and then we'll talk about forms of loss. Grief is a characteristic, typically a characteristic response to the loss of a significant or valued other, person, pet, or object. But there are obviously different levels of loss, and how do we talk about significance? So, for example, we could say, I have an experience, I lose something, such as my phone. We wouldn't expect someone to necessarily grieve over their phone, unless perhaps there are a cache of pictures on that are the only place they exist or of a loved one. And so there may be some deeper sense of loss, but still not likely something you would enter into a distinct experience of grief about. Compare that to the loss of another object. Let's say your house gets burnt down in one of the current wildfires. That's more than just a thing. It's a place you have spent a lifetime. It has very particular memories, that the location itself has so much meaning. That is an experience where we might expect a person to grieve. And it's not only the physical location and all the memories within it, it's also the neighborhood and the people around, that you're not going to be in the same relationship with them. You're not going to see them in the same way. Versus then the loss of a loved one, the significant other, which again is what we more typically think about when we're considering loss. Now we're going to talk about a variety of forms of loss that as they accumulate, particularly as we age, can give rise to various forms of grief that often I think go unrecognized and untalked about. So that's how I would connect the two and distinguish them.
Yeah, that's a good distinction. And I think you bring up a good point, and something that's very appropriate for this audience is losses that we experience as we age. And I'm going to ask people to type something into the chat. I'm just going to pose a question. Like, as you've gotten older, what's an example of a loss that you've experienced? Um, I will share, loss of looks, is one, and loss of just kind of physical fitness. I just can't do what I used to be able to do. So, how about the rest of you? What do you feel comfortable with? And I'm going to read some of these out loud. Loss of husband, parents. Gina's father died 2 months ago. I'm so sorry. Parents. Yeah, so here we're talking about a lot of deaths of family, but somebody mentioned loss of robust, good health, a best friend, not able to move freely physically due to injuries. Yeah. Loss of driving, loss of a husband to Alzheimer's, which could be through death, but it could also just be losing that relationship that you had. Yeah, memory, somebody talked about. Someone's mentioned that as we seem to be on a losing streak every day. And then loss of friends in my generation, mentors who died too young, cats, retirement identity. So the list goes on and on. So what would you say, Dr. Moore? What other kinds of losses might we experience as
Mhm.
we get older? And then I'm also curious about like what happens if we don't acknowledge it? We just keep that kind of bottled in.
So already they've touched on the most obvious one that comes to mind for all of us is the loss of someone significant, and be it the death of a partner and death of parents as we get older into our 60s and 70s. If our parents are still living, they're likely in their 90s, and that's an age at which most people are not going to live past into see the next century. Um, just to give a sense from the 2021 American Census, for those who are over 75, close to 60% of women and about 30% of men had lost a spouse. And by the way, that discrepancy in gender is because men tend to die younger. So more often, older women have already survived their husbands or significant others. Um, Also, I think which people don't often appreciate is that as you continue to get older, if you are healthy and live into your 80s and 90s, there is an increased possibility that you may live to see a child die. And I don't think people often consider that, because the natural progression of things is we die before our children.
Yeah.
And I'm not talking about traumatic loss at a very young age where a young child dies. I'm talking about an adult child. Approximately 10% of people over 60 have lost an adult child. So
Mm.
it's another form of loss I think is just profound. Um, the, Beyond loss of a significant other, there are several other themes that are coming up here. I think clearly a major one is changes in our body. You mentioned like changes in looks, which also taps into how people look at us, how they respond to us, our own mobility, our health. I think there's a mourning that can go on for our youthful self. There can often be this discrepancy between the level of desire we feel for how we want to live life and then what we're in fact capable of doing. Um, the loss of reciprocal relationships. So, for example, you may have, when you were younger, enjoyed a dependency at a very young age with your parents. And as you get a bit older, you begin to hopefully develop maybe more into a friendship with them. But as time goes on, then it begins to shift that you may end up caring for them. And while you still have the relationship, what is lost is the form of relationship you may have enjoyed in those middle years. Then there's loss of family and friends, so not just significant other. And one person mentioned loss of peer relationships. So that is a shift that we begin to see, particularly as we get into our 70s and 80s. We see an increasing number of deaths of friends. And the loss that goes out to people who know us, who can understand what it was like to be raised in a particular generation and share those experiences, the people who've known us for decades. It's a major loss. I also want to mention additionally, there can be an increasing disconnect with the younger generation, in part because the younger generation, I think, unfortunately, have a tendency to look on us as we age as of less interest, of less relevance. So that's another part, our role in the community. As we retire, we may feel we don't have a place in the world in the same way. Common complaint that grandparents have is wonderful experience in their 60s and 70s with young kids. As they hit their teens, there's less interest, less contact. And as they hit young adulthood, appropriately, they're off living their life, and there's not a whole lot of time for parents. There's far less time for grandparents. I think it's a major loss for us as we age. The physical side of it, I want to mention, um, mobility is a clear one. The sense of being physically well and fit. Like if you I have one patient who loved to hike, and then because of increasing hip issues, wasn't able to go hiking, and that was such a major part of this individual's identity. So that was a loss. Um, Other things I think that again Selim talked about, the loss of touch. And I'm not just talking sexually intimate touch. I'm just talking about a hug, someone there beside you, shoulder to shoulder, someone to hold hands with. Um, Physically, also the loss of hearing, which is a major barrier to relationships and friendships, and enhances our sense of isolation in the world. Also, loss of vision, which for some people can lead to an inability to be able to drive and have a different form of mobility in the world. And someone mentioned memory, intellectual sharpness, cognitive capacity can be changed. So those are some of the range of losses, which when you sit back and think about it, getting old is not easy.
Yeah. I'm going to add one, and
Mhm.
that is it kind of came up at loss like of our pets. And I'm
Yeah.
saying this because many of you know how much I love my dog Bella. She doesn't have a puppy sitter today. She was barking her head off here. So hopefully, hopefully she'll be quiet now for the rest of the presentation. So, Dr. Moore, what happens? Like you've listed quite a few losses that I hadn't even thought of, and we're listening to this. Um, what happens if we don't talk about it as we get older? What if we just bottle it up and keep it in?
So we can talk about the effects of it over time. And this is going to get into a broader discussion about what do we do both for ourselves when we're grieving and what can we do for others who are grieving. And at the heart of it, I am obviously as a therapist, I'm a firm believer in the great value of talk. There are other things though I think that are important too. So it's not only talk, but this notion that we wouldn't address it I think is crucial to understanding why some people are able to move through grief over time and why for others it's more difficult. And there's a variety of external factors, but I just want to say a few words about the typical course of grief. And this is very important. When we talk later about therapy, and we'll come back to this point, there is a characteristic response that most people go through in the course of anywhere 6 months, a year, 2, 3 years, but it's rarely beyond that. The first stage, typical for most people, is the difficulty of taking it in. It can feel like a state of shock or disbelief, even though rationally they know the person has died or the loved other is gone. There's still a way in which it doesn't feel quite real. That is the acute phase of grief. And then what begins to enter in is a growing awareness, not yet a full acceptance, but with it come heavier emotional experiences such as sadness, emptiness, pain, acute sense of loss, sometimes guilt. Could I have done more? Particularly if someone is ill, did I do everything I could to care for them? And with it, often a withdrawal from the world. And I think that's also a sign of the beginning of the work of mourning and often a general loss of interest. So that's what we would think of as the typical classic presentation of prolonged grief, normal, natural grief. And then with time, and this I see consistently, there is a period of restitution or recovery. And that I differentiate as the phase of mourning. People often equate the two, but I think mourning is a work that we do and something that occurs as we sit with loss over time, whereby what happens is that we still feel the sadness, we still feel the absence, but it's not quite as constant. It's not taking over every part of our day. And we're beginning to notice ourselves move in and out of it until gradually patients after about that year period will say, something has shifted. I still feel the pain. I still miss them so much. It's not that you forget them or stop thinking about them, but the acuity of that sadness, that emptiness, that pain has begun to reduce to a point where you're not suffering with the loss in the same way. So I wanted to stress that because I think it's important to understand what the typical course is. Um, However, there are barriers to that and factors that can play it that can complicate the course. So even in fact, there's a clinical term, complicated grief, and I'll get into talking about the treatment of this as distinct from typical or normal grief. That's a loss that is unexpected. There was no preparation for it. It was a very profound, difficult loss. For example, a violent death, a suicide, a death of a very young child, or something that's very abrupt, like an accidental. Somebody gets, killed in a car accident. And you didn't see it coming, and there was no time to say goodbye and to be prepared for it. Um, that is a more complicated form. And that is often quite distinct. There, the person can have greater difficulty in processing it, is not only dealing with the typical loss we all deal with, but now this other complicated piece, which is trying to come to terms with the nature of the death itself.
So let me back up to a
Yes.
couple of things you said. So this is very interesting. And part of what I heard you say is that it's not like you go through step one, step two, step
Right.
three
Right.
with grief. It is individual.
Mhm.
And it's possible, if I understand this correctly, that we may kind of go along our way and then go backwards. Am I right?
Oh, yes.
That happens?
Yes. Yes. And anyone who's on the call who's familiar with the classic work on grief might have heard of the stages of grief. DABDA, denial, anger, bargaining, depression, acceptance. They are very useful concepts, and often they are part of many people's experience. I mean, again, denial is that initial stage. Is it really happening? Then also in the very early stages, anger over it, but other intense feelings too. I think sadness is more common. And this is often leading up to the loss. But then once it's accepted, you enter in that second phase of depression. Now, that's a general description of what happens, but it's not so linear. That's what more recent research has shown. People jump around, do it at different phases. And not everybody does everything. So there was used to be an idea, well, you have to go through each of those phases. No, you don't. That's not the pathway to help. That's just a description of how we've noticed many people do often do it, but it's not sequential, it's not linear. I think one of the most important things for for understanding those around us who are grieving or understanding our own grief is there's no right way to do it.
Yeah.
And one of the best pieces of advice I can give, particularly in the early stages, is to empower patients who are grieving to be able to say to people who are telling them, well, it's been 3 months now. I mean, yeah, you need to be getting out. No, maybe I don't. Maybe you would, but this is my grief, and there's no right way to do it. It's simply moving through time. And that, I know this does sound, and I try to avoid cliches, it is an incredible healer. It's not the only healer, but often that's what people need, is to do it not only on their own time, but in their own way.
Yeah. So you were talking a little bit here about losing a loved one, a spouse.
Mhm.
A question came up in the chat, and I think it's a really good one. Margot asked, where does regret fit in? And Charity
Mhm.
said, what about grief for an unlived life? That was something I hadn't even really considered. Is it possible to grieve that?
Oh, well, that's regrets. There can be regret, for example, in relation to the loss of a loved one. That did we spend enough time? Did we show our love in the way we wanted to? And that's complicated by, for example, the abrupt forms of death. If it was an accidental death that came out of the blue, or a very short course of aggressive cancer that it was weeks as opposed to months and years. Um, there can be regret related to time, to togetherness. And I think we're naturally guilty beings, and we're always looking to to what we didn't do, couldn't have, should have done, and often struggle. And I think this is good work that can be done in therapy to recognize the continuous experience of being in relation to someone or something that we love. And because it's good and benign, assuming it was a good relationship and not complicated by more turbulent aspects of a relationship where that can be more difficult. The good stuff is often taken for granted. You know, it's waking up in the morning and enjoying a cup of coffee together. You don't have a explicit memory of that. That's not what you're writing your journals about because it's just part of your lived experience. And that's the thing that mattered. Whereas if
Mhm.
you're thinking, we never got to that vacation, down in Peru, that is a loss. That was something you'd hope for, but that wasn't the essence of the relationship. That was a highlight. And I think as we begin getting caught up on regret for big moments, we tend to minimize why we're really feeling the loss, which is the continuous ongoing involvement with that person.
Yeah.
I do want to address the other question, which is a lovely one about an unlived life. Did I do enough with my life?
Mhm.
The psychoanalyst Eric Erickson, and if you haven't heard of him, I recommend reading some of his work. He was self-taught, self-trained, and he had a profound interest and one of the first psychologists to think about our course of development across the lifespan. Everybody else is looking at kids like, 0 to 10, and then later adolescence, but kind of stopped there. And he said, what happens in late adolescence, early adulthood? What happens in midlife? What happens when you get to retirement age and beyond? What happens when you start facing your own mortality? And he talked about different forms of work that have to be done at different phases of life. And towards the end of life, as we enter into kind of the late autumn, early winter of life, he said that the work then is often about coming to terms with the life we've lived as the only life I got to live. No one else could have lived it for me. And I may have had ups and downs, regrets, but that was the life. That's the place I took up in this world. And is there a way to look at that and come to terms with the fullness of it and not just with regret? And he says there's various factors that go into reaching the end of life. And it's not simply the content, oh, I got to be the top of my career, or I achieved this wonderful thing, or I wrote the novel I always wanted to write. It is also about understanding the richness in just being a person in this world. And often it comes down to not the achievements, it's the relationships we have.
Yeah.
But the last thing I'll say here is there is, in fact, a form of therapy based on his life review therapy. I don't know how many people are out in the community practicing it, but if you're interested, that's a thing. I would seek out someone who specializes that, or I do find therapists like myself who specialize in psychoanalysis tend to have a deep interest in these questions about how we value ourselves, and especially as we go through life, how do we look upon it and not be full of shame, regret, embarrassment, but instead come to a point of being able to love ourselves in the life that only we could have had. So
I'm so glad we got that question. It
that's right.
wasn't one we Dr. Moore and I had thought about some questions in advance. We hadn't planned on that one, but I think it's so important. I love what you said. We are you said it more eloquently, but by nature we're guilty beings. And Kate wrote in. She's a pet loss death doula, so she helps people get through the loss of their pet. And she just mentioned that so many people in that situation are going, oh, if only, or what if, or did I do the right thing? And
Yes.
it makes it harder on ourselves. It's hard to stop doing it, but it does make it harder on us.
I think one thing that's particularly difficult, and having just had a patient who lost a pet after the loss of a significant of his partner, um, the 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 difficulty when we lose a pet is the pet can't talk to us as they're going through their illness or they're dying. They can't say, no, no, hold off on the palliative care because I want another couple of weeks. I'm not in that much pain. Or, yeah, this is unbearable. Please help me end this. We have to make that judgment call, and then we're racked with doubt and guilt. Did I do the right thing? Was it too late? Was it too soon? And I think that's a particular challenge with a pet.
And I'm just curious, Do you have advice for that? Because I think it's one thing to acknowledge that that's our kind of go-to
Yeah.
mindset. Is there something that helps with that?
It's in fact the same advice for when we're struggling with questions. Like often I'll see adult children struggling with, was I right to, bring in hospice at the time I did? Should I have done it sooner? We always will fill that endpoint because it's so significant and it's such a difficult responsibility. I will always point to how that conflict comes out of deep concern for the other. It's never coming from a position of sadism, neglect, I couldn't be bothered. It's the desire to do right. So there can't in that be a wrong. Your decision, if it's coming out of love, it's coming out of love. And so that's what I try to bring people back to is what you're feeling, that conflict, that guilt comes out of deep compassion.
So I love that, and that's helpful. And it's kind of like acknowledging the goodness and the good heart that we have,
Yeah.
instead of seeing it as what didn't we do? Yeah.
Right. Right.
Let's go back to what we were talking about before, which was the loss of a spouse, maybe after
Mhm.
battling a long-term uh, illness. Um, a lot of times we as friends want to help that person. And we say goofy things. Like you mentioned it before, Dr. Moore. You said, we said, wow, Joan, it's been 3 months. Do you think it's time to get out a little? So, what are some of the goofy things that we say that might be well intentioned, but just sit
Mm.
wrong with people?
Yeah. Yeah. Um, there are a few that come to mind that I hear most commonly. So the first one I think is a very difficult one. And I please everybody on the webinar take this with a serious dose of salt. Because the intention here is it's so well-meaning. The complication of asking the simple question, how are you doing? It's the kind of opening part of conversation. And when someone who has lost someone, the first time we see them, we often load that question. It's not like, how are you doing? It's like, how are you doing? And that can be often well received. Thank you. That feels like an invitation for me to be able to say, I'm having an awful time. I'm feeling so alone. Now that the funeral's passed and it's been a couple of weeks, no one's really there talking about the person who's died. Or it could be, oh, I'm not ready. I please, you're getting in too close. I just wanted to have a cup of coffee and talk about the Olympics.
Mhm.
And there is no way for you as the person trying to offer support to know. So I just want to give that example, not that it's a bad thing or a good thing. It's just an example of how hard it can be to know where the other person is. Um, the the other issue that I think is very important, this is problematic, is our natural tendency as human beings, and as Freud put it, we're pleasure seeking, pain avoiding. And he saw that as a central motive. I don't think that's all that we are, but it is a large part of our makeup. And one of the things we are profoundly inclined to do is to minimize discomfort and pain. And that includes having to take in the pain of another. So while consciously we are often sincere in our wish to find out how the other person is and to give them space to talk about their loss, we also find it very difficult, despite our wish to help, to tolerate their sadness. And so, one of the things I often hear are family members, friends, close people that have been very supportive over the years, often wanting to relieve us of our sadness. And the conscious thought is, you're sad, that must be awful. Can I move you out of it? But really, what it is our own inability to imagine ourselves sitting in that sadness. And so, therefore, our inclination is to move the person out. They can't move out of it. They're soaked in loss. This is that stage of grief. And to ask them to be anything other than sad or whatever it may be that they're feeling in the moment, anger, regret, guilt, that is the work of grief. And so I want to stress this, and it's not to point fingers because we all do it. Even as a therapist, when my patients are bringing difficult emotions, there are times when I can feel it in myself wanting to move them into a better place, wanting to end the session where they're feeling a bit better about themselves. And again, I think it's a healthy inclination, but there is something to be said about providing the other the space to have their feelings. And so I
Yeah.
just really encourage us all to think about that. It be it with a family member, a friend, or for ourselves to ask for that. I don't need to get past this yet. It will come with time. And so I think that's something that's often not recognized.
Yeah. So, Gina asked a good question, and it's a
Yeah.
perfect follow-up. She said, "How do you do that?" So let's think about it first from the person who's experiencing the loss. They have friends in their life, friends or family, well-meaning,
Mhm.
um, who are, maybe not as sensitive as they could be. They're trying to help.
Yeah.
How does a person who's experiencing grief tell that person what they need and like kind of back off? Is there a way that they can do that?
I think that is difficult. I am very sensitive to how much emotional work a person who is grieving is already doing. And so my hope is that there are people around them who just intuitively know to tolerate whatever mood they're in. If they say something testy or ask you to back away or don't want to go out for dinner on the night you've been preparing something for them, that you understand this is going to be difficult for a while. But I also do need to help patients be able to speak up. So one of the things I have found helpful is to say to people who are grieving, it is normal for you to be having these experiences. This is how the world moves on. The world is not very good with grief. And one of the things that will come out of your own grief is you're going to have an awful lot more empathy and understanding for those who go through loss. But most people want to push it away. They're not bad people. And your friends are not letting you down. They're just being normal. But you do need to let them know because their inclinations aren't always going to be the most helpful. And it's okay to say, and often we'll just practice. How do you say it in a way that's not angry or dismissive, but say, I know you're trying to help, or I know that's well intended, but right now, what I feel I need, and it's not saying it's right or wrong, saying what I need right now is space, time to have my feelings, whatever it might be.
Yeah. And I think, you and I chatted a little bit before, Dr. Moore. It's the person who is grieving, just being okay with whatever that stage is and not
Yeah.
expecting it to fit some kind of model or theory.
Yeah.
Okay, so let's talk about now me as a friend. I mean, I think one of my main intentions in holding this webinar was how can I be more sensitive? So the first is just acknowledging that I may want to help somebody get past something that they don't want to get past. Um, the question came up about, do you mention, let's say somebody lost a loved one. Let's say they lost their husband. Do you mention their name? Do you not mention it? I've heard people say, oh my gosh, nobody ever talks about Frank anymore. Nobody ever says his name.
Yeah.
And yet, I think as a friend, you don't know if you should bring it up. What's your thought there?
My general advice, again, there's never a one answer to all these situations, but my general advice is there is a profound isolation and loneliness that can occur on top of the loss for a person who is grieving as the world moves on. And I've said that already. This notion of your world of friends, the community, the world is wrapped up in politics. There's events happening. There's people celebrating weddings and birthdays, etc. And you're still in a world without your loved one. And for you, the world hasn't moved on. And it can feel as though the world has forgotten the person, pet, the loved object, that you can't, that you're still grieving. And so generally, I do think it is important to continue to create and allow space for the person who's grieving to talk about the person they lost. And I find most of the therapy I do, it's not like other therapy where I'm working to kind of sift through what we need to get to. Work with people who are grieving is actually quite straightforward. It's me often just asking them about the person who died. giving them space to talk.
Yeah.
And then eventually they get to their own feelings around that. And it's not just memories, it's also where they are now. But I think that is important. But in saying that, it's not that you're sitting them down at the kitchen table and you're saying, okay, we're going to talk about Joe or Mary. You just bring it up. You might say, for example, something very natural like, yeah, I'm aware today is, would have been their birthday, or this is, I was last week, I was at that restaurant and I was thinking, how we used to go together. They will pick it up. They will either be glad to hear you remember them and they will want to say more, or they'll just nod, say nothing. You take your cue for them because the other thing is to allow them whatever space they need. But I do think it registers. And I think it's profoundly significant. And I think a generous gesture to continue mentioning how you also have them on your mind, that they're not
And,
forgotten.
and we had talked about this earlier, and I tried it. I just have to share this with the audience. My neighbor, Kieran, dear woman who lost her dog, Basil, he was 17.
Mm.
And I mean, it was a year ago. And Bella and I were walking by her house, and she was out on the front patio. We just walked up, and I said, Bella and I miss Basil every day.
Mm.
And she was so thankful to hear that. She just sat down. We just all sat on her porch and she talked about him. And it was the most amazing thing. Yeah.
Yeah.
So some questions are coming in. These are really good. Can you comment on the kind of grief we might experience if we have like compound loss? Linda mentioned
Oh,
that,
okay. Yes. Yeah.
her brother died unexpectedly, and then in the same, short period of time, it was her father and her husband and her sister. So there was a lot of loss
Yeah.
in a relatively short period of time.
Yeah, I think this is an example mentioned earlier where you've got typical grief. And if we're fortunate, it will be a single loss and separated, and the next loss there will be some time that we maybe have moved through mourning. I had a patient recently ask me, the patient lost their spouse as their dog was getting ill. They were talking about how they expected to be um, prepared and better able to get through this. And of course, when their dog died, it was profoundly painful, in part because I think it was layered on top of the memories of their husband who had died. Um, I think we suffer more with compound losses. It is very difficult to remain resilient, which is just simply another way of saying we adapt, right? Grieving, moving through the mourning process is our natural way of adapting to the loss, coming to terms with living in a world without this loved one who's no longer there. But if it's loss after loss after loss, and particularly if there's not much time between, and I don't mean weeks, it could be, 1 year, 2 years, we're not yet fully out of our own grief for the primary loss, the first loss, before we're hit with another. And it can
Mhm.
begin to feel as though the world has turned against us. There are this is from the literature on resilience for example, trauma, but it's also there's been a lot of study of resilience in the face of loss too. And there's a few ways, and I just want to make sure I mention them all. There's a way in which some people can develop a healthy hardiness around either trauma or loss. And some of the ways in which that can be facilitated is striving to find meaning in the loss. It's not to say, oh, loss itself is inherently good, but rather the person who I lost, who they were in the world, what I'm making of that, what I do in memory of them, for example. Um, Regaining some perspective on, even though these things are happening outside of your control, it doesn't mean that your life is now this random, dangerous experience where anything could happen. You have to be able to also understand how this happened, why it happened. And it doesn't mean that, for example, you're going to die tomorrow or another loved one is going to immediately die. And that can be difficult if it's cumulative loss. A harder one, especially if there's a lot of a lot of losses, being able to see that there's some way to grow from a negative experience. But I'm hesitant to put that forth as a way to deal with cumulative losses, because I think that gets harder and harder to feel that there's just so much sadness. The the other unusual way that some people cope is through self-enhancement. And by that, it's saying, I've become someone who is an expert on grief. And like I'm gonna go out and like counsel people like how to get through it and look at how well I'm doing. And that can be great for their own sense of like this internal sense of control, like, and I'm growing through it. But the problem with that kind of self-enhancement is it can be very off-putting to the rest of the world. It's got a narcissistic element to it. So in fact, you can end up isolating yourself more. Not a particularly good way to do it. And then the other two ways I want to talk about, one is negative versus adaptive coping mechanisms. The negative one is, oh, sorry, I'm doing this Zoom thing where the balloons go up for a bit, not very appropriate for a talk on loss. But speaking of adaptive mechanisms, repression, which is to push down our feelings. And that works in the short term, but in the long term, it tends to lead to other problems such as somatic problems because pushing down some of that feeling tends to take a toll on our body in terms of stress. Better coping mechanisms are recognizing, talking about, expressing our feelings. So even though that can be hard and painful, that's a general rule in all forms of therapy. Better to feel it and say it than to push it down. And then the last thing is laughter and humor. I mean, I
Oh,
saw
good. A
humor.
question came up about humor.
It's not that you're making flippant jokes about someone who's dead, but that there is a way to maybe get back, maybe in talking about something else that's lighter. And that's not being superficial. For a person to be able to reconnect with the capacity to laugh at something else, it's both it's a reintroduction of something other than sadness and emptiness and heaviness, but also it's social. If you laugh, people want to be around you. And I think that can act as a counter. And I'm not saying if you're grieving, make sure you're also being kind of happy all the time so people like you. But if you can think about finding some way, someone to be around where there's some laughter, I think also that the social connection is a very helpful part of that.
There's so many questions coming in. I'm going to
Oh,
start
great.
taking these, but there's one question that I want to ask, and then I'm going to just go to the Q&A in the chat. And it has to do with when do you see a therapist? So let's say I'm
Yes. Yeah.
experiencing grief. Do I find somebody like you? Is that good? Is it not good? What are your recommendations about that?
So you and I have talked about this before when we were preparing
Mhm.
for this, and it's a there's a surprising kind of complicated answer. There was a study back in 2007, so over 20 years ago. Not an awful lot of research on this, but there was a startling study that came out, and it found that most people didn't get a lot of benefit if they were going through typical grief reactions from therapy. And in fact, the results suggested that close to 40% of people who underwent therapy for grief did worse. Shocking finding. It entered the literature. People kept talking about it. And I even kind of had in my head, I was like, yeah, I don't know, grief, it's not for everybody. Grief therapy is not for everybody. But there was subsequently, and I did a bit deeper digging since we've been talking, another study, 2007, that found this was a single dissertation study. It wasn't well designed. And so the results are questionable. They looked at a series of many other studies. And what their conclusion was there are positive effects for therapy, that it does help, but less than typical therapies for psychological issues like depression, anxiety, OCD, substance abuse. People tend to do better with those problems. Grief, there's an effect, but it's not as profound a change. So again, it's not going to harm you, but it's not going to be as effective as it would be if you're presenting with other problems, which is going to be relevant when we talk about complicated grief. Um, the stronger effect they found, though, was when comparing people who were put into a trial for the experiment versus people who are self-referred. So that's another thing. I think community-based counseling, people who need it tend to refer themselves for therapy and will generally do better. So I don't want you to take from this therapy doesn't help or doesn't help much. I think if you feel motivated and you're the kind of person who has a sense that it's at least worth trying, you will probably get greater benefit.
Yeah.
Um, the other thing I would say is to consider factors that certainly for me as a clinician, what I'd recommend a person to get therapy. If there's not an awful lot of support, social support, family support, if you're generally isolated, I think that's good as we age anyhow, having someone where you can sit and just talk about your life and feel like someone has investment in you and interest in you. I also think complicated deaths, if it was a suicide, it's very complicated. It's not only sadness, there's also anger, a lot of questions. If it's the death of a child, it's, again, that's such a difficult loss for people to come to terms with. Or if it's a violent or unexpected death. And the other one I would say, it's very important if you have a pre-existing condition. So, for example, if you're prone to depression, that has an awful lot of overlap with grief. They're not the same thing,
Mhm.
but it can reignite some of the depressive symptoms and could restart an episode of depression. So I think it's good to preemptively get in talking with somebody. Um, all of what I've just said is different when it comes to complicated grief. And complicated grief, some of the ones I mentioned, right? Very particular forms of death, very, very deep forms of loss, unexpected. Also, if there's these pre-existing issues, but if there is a a difficult, fraught relationship or an overly now we all have some healthy dependence on the people in our lives. That's not a problem, but an overly dependent relationship or a very enmeshed relationship, um, often the mixed feelings are harder to resolve and don't take the course of normal mourning, and that person can become stuck in grief. They're perseverating. A lot of anger also is being felt either around the people who treated the person or the person themselves, and there's a preoccupation. It's not just that they're on your mind, you miss them, but you're living as if in some way they're still around. Those forms of therapy, those forms of grief do in fact typically need therapy. They do respond to therapy, quite helpful. Cognitive behavioral therapy, meaning centered therapy, the life review therapy I mentioned, group therapy for anybody, even just support groups. We didn't mention that. It doesn't have to be a formal therapy group. Sitting with other people who've gone through loss is an incredibly helpful experience because they know what you're going through for the most part. So I can't emphasize that enough. One thing I will say that's very interesting about complicated grief, and here's where I think grief and depression are different. Medications alone don't help. They can help if done in conjunction with therapy. But if you're thinking you can go to your doctor and say, I'm having a lot of grief, can you give me an antidepressant? It's not likely going to help.
Let me go to some of the outstanding questions that people have, and I'm going to try to get in as many as I can. Jackie said that often people who are grieving don't know what they want or need. So how can she, as a friend, help
Mm.
them if they're not able to even talk about it?
Oh, that's a great question. That I
Isn't
don't
it?
know. There's not an easy answer to that. Because part of what's difficult is understanding what's going on that they don't understand that they could be helped in some way. It could be that the grief itself is so profound, and I would begin to think about, is it a complicated grief? What was the nature of the loss? Like, very unexpected, very complicated. Or is there something in their own history around um always feeling, for example, that they're the one who has to help others, and now that they are in need of help, that could be a lifelong complication. That's not just about the grief. Um, Again, all we can do is respect what they are going through, continue to show up and take their lead, but also not to feel we can't talk about our experience of the loss, and not to that we would equate it, but we could say, I'm thinking a lot about Jill. It's been 6 months now, and do wonder how it is for you. And I know for me, so sometimes it's like working with someone, like if I'm working with a patient who doesn't have words for things, I'll often begin to put words around it. Even I'm speculating and taking a bit of a stab at it. But to begin the conversation, I think of that not as trying to impose my experience on them, but offering some words and possibilities that may land and they may pick up. But
Yeah.
I have to say, there we have to be a very patient, good
Yeah.
friend.
And I think something you said today and in our earlier talk is continuing to show up, because you said so often when someone loses a person that they love or their dog or someone dear to them, there's a lot of outpouring of sympathy and attention at first, and then there's nothing. Yeah. We have a couple of questions related to dementia. And this is near and dear to my heart because I do research related to family caregivers of Alzheimer's patients. This person said, what do you recommend if a person with dementia has a sister who dies? How do you tell them that she died? And then how do you continue to tell them because they forget that she died?
No, I don't know that there's a good or right answer to that.
I know, I
But
know.
it would depend if their memory is such that they truly cannot remember. And there's a lot of debate around different forms of memory. There's declarative and procedural memory. Just very quickly, there's the way in which we can remember a story about our lives, like, oh, I remember that time when I went to. And then there's the ability, like, you don't have to tell a story of how you ride a bike, you just know it. We can think about relationships in the same way. There's the narrative, the story we have. My sister's still alive, my sister's not alive, versus the emotional impact that a person with dementia, maybe they don't remember on the level of the narrative, but there's a feeling of, for example, of absence. And maybe they'll project onto you, like they'll see you as their sister. So again, I said there's not a right answer. It may not help or not help to answer on the level of the declarative, like your sister's no longer living, died this, and keep repeating it. But you could be open to any cues from them if they start talking about their sister. And it may not be that you have to say she's dead. You that may be just them missing her,
Yeah,
which is also loss. And so you can talk about that. If you do, when you normally you would tell them the first time, if they're very distressed, they're not going to get less distressed the next time you tell them. If anything, it's just like a new daily reoccurrence. And we've seen this with patients, even younger patients with forms of like brain injury, where they're aging and they don't have a memory for day to day what's happening, and it can be traumatic as time goes on. When they wake up and see themselves in the mirror, they don't have the capacity to use memory to process the loss and come to terms with. So they can't do the work of grief. So if the first response is deep distress and they can't seem to, or if you bring it up a second time and it's not getting any better, I think your cue then is it's not going to likely change, but you can just remain sensitive if they're saying, oh, where is where is Jane? I haven't seen her for a while. Or they start thinking, oh, Jane, hi, and they're recognizing you. Go with it. That's what I
yeah,
would say.
yeah. And then a next question came in, and this is again something I've studied quite a bit. It has to do with the ambiguous loss. So it's like if my
Mhm.
husband has Alzheimer's disease and I'm losing him to the disease, he's still there physically, but he's not the same. And it's a different type of loss. Can you say a little bit more about that and how we might cope with something like that?
That is a profoundly difficult loss, that where there's somebody who is there but not there. And I think particularly for older children with parents who are becoming increasingly demented or having memory difficulties. Um, I think what's important is, one, to be very mindful of the natural tendency towards guilt around our ambivalent feelings. And they're ambivalent. It's both love and loss. They're
Mhm.
there and they're not there. And it is natural to have mixed feelings about it, to anticipate that, and to, for both them and for us, to begin to think about and then to put in place for yourself a limit around what you can do in that relationship, how relating can you be, to be able to appreciate, I will spend some time with them. It may not be all day because it's too painful, but I will go for a walk. And I know going into it, they're not going to remember my name, or they'll get confused, or we won't be able to have conversations about much of what's going on in life. And I don't have to continue to be in that. I also have to understand that the loss is already happening and how to begin my own work of anticipatory grief. So I think not letting the guilt forces to push past the ambivalence and feel, oh, this is awful, but I've got to be there for them. I've got to make myself love them as if they're still the same person. It's like, no, my care and love is going to be maybe in smaller amounts of time, but what I can tolerate and what they can tolerate, because my sadness also needs its space too.
Yeah. Yeah, I know this is a tough one. Rita asked a good question here. I think I'll take hers as a last question and then we'll kind of wrap. how do you deal with a friend who's told you that she only has 5 years to live? And this is complicated by the fact that this friend is bilingual, English is a second language, she has aphasia, so she's not a good communicator. How do you help somebody who says, I only have X number of years or months to live? Mm,
Oh, well, my first question is, and it's only reinforced by the fact that it's second language and as soon as second language and there's an aphasia. The minute I heard that question, I'd say, "What do you mean?" And I think that's just a very natural impulse for me, and I would stand by that. Um, I don't think the question was, "What do you do?" You do nothing. There's nothing to do. Hurry up and do nothing. Meaning, be curious about it. There's nothing you need to yet figure out. They're telling you something that isn't yet clear to you. It may not even be clear to them. And so my first approach, even with someone where it's clearly communicated, maybe there is a terminal illness they're dealing with. I just want to hear more
yeah.
because we don't have to rush to doing yet. I think what's needed, again, notice I've repeated this a few times, creating space, not only for the other person, but for ourselves too. You don't have to worry that there's something to be immediately done. Give yourself some time and space to figure it out with them.
Yeah, that's a great answer. And I think it's a good summary of what we've discussed. I will tell you that my takeaway from today and having enjoyed some time talking with you before is to have a conversation. So whether it's the loss of a loved one or something we talked about earlier, the accumulated losses as we age, not to try to tamp it down, but to be around other people where we can have an honest conversation. Like I found just our dialogue very, very helpful.
Yeah. And the
Yeah,
other word I just want to add for everybody, honest, authentic, but also open. Just creating an openness. You don't have to worry about what you're going to do or some of these questions were very complicated questions to which there's no right or wrong. I'm a clinician. I don't know what the right or wrong answer is, but again, can we approach it in a way that opens it up for both of us? And then there's possibility.
yeah. I think that's a great way to end. We are hard on ourselves. Some of the questions were like, how do I do this right? Or what's the wrong thing to do? And what I'm learning from you is to come from the place of the heart, but again, to be open to what that person needs, not to always be doing or controlling.
Yes. Yeah.
Yeah. Any final words of wisdom here?
That I think leaving it on that is a good enough way to end the notion of being open, because in a way to grieve is to re-engage with life, and that means being open to its possibilities and not stuck in the loss, that the world can feel empty or bereft. What happens when that space opens up as opposed to closes on us? And so that's the final word that I want to do. This is about living. It's not
Yeah.
about time.
So good to have you on the program, Dr. Moore. Thank you. And to thank you for everyone who joined us and who talked very honestly about things that are going on in your life. Have
You're
a
welcome.
great Wednesday, everyone.